Hi, Rajan. निरंजन ऐकू येते?
Am I audible?
या थोडा आवाज मला कमी आहे.
Yes, you are audible.
सर तुमचा आवाज येत नाही. I couldn't hear you.
नाही येते, मी अजून बोललो नाही. पण आता सीमाला येत होता. येतोय आवाज?
सर येतो.
Yes,
येतोय
sir.
तुम्हाला?
Yes, sir. Yes, sir.
Hello. Shall we wait, sir, for
या या
quick?
5-10 minutes.
एक मिनिट.
असं. And these are the yama, niyama, and then 8 limbs, asana, pranayana, pratyahara, and then types of yoga. We have Ananda Yoga, Ashtanga Yoga, Bikram Yoga, and then Iyengar Yoga. And these are the various postures. And it is very popular that whenever you go outside on the hills, you'll find people doing yoga. So, okay, I think I'll just pass it on. The clinical significance, yoga can reduce stress. That is one of the main aims for people doing yoga. It gives you the spiritual growth, and then it gives sense of well-being. And that's why Niranjan always follows, because he runs a school of well-being. It reduces anxiety, muscle tension. It increases strength and flexibility. There are some papers we suggest that it slows aging. I'll show you some papers. It shows you sound sleep and improve medical conditions. It reduces your heart rate, reduces blood pressure, and allergy and asthma. Anybody who cannot understand can raise the hand, and I will explain. So practicing yoga can be best thing to provide and himself doing simple pranayama. That's the breathing technique. You can become calm. Practicing yoga for half an hour a day can make your body fit, and yogic thought process will teach you. All that huge what you call as following was after Dean Ornish published his book Reversal of Heart Disease with Yoga. He came to India. He was a disciple of Swami Satyananda, and then he thought that yoga, especially the pranayama and all that, can reduce the heart rate. And then he had initial study done, and then he went to All India Institute of Medical Sciences, and then he wanted to present. But subsequently, nobody was believing in him. And then he went back and he conducted a randomized controlled trial for the first time to show that there is a reversal of coronary artery blockage. Coronary artery means artery of the heart. And he had then all his yogic diet and what's called the Ornish diet. And then subsequently, whole thing started moving. So the credit of making yoga popular in Western societies has to be given to Dean Ornish. I would advise everybody to read this book, Program for Reversing Heart Disease. And it's one of the fantastic book on yoga. And then these are the first results where it showed the positive results of intensive lifestyle changes which can reverse the heart disease. And then he used yogic practices, and then he had a website called Ornish Living, where yogic practices are there. And then the goal of this yoga practice to reconnect to the place of peace and within us. And then he was using meditation, and it reduces the blood pressure, improves relationship between the body and mind. So this is a paper which is available now. So basically, if you see all that yoga, the most powerful thing is breathing. Now you have two types of system called voluntary system and involuntary system. So muscles, they become voluntary, whereas remaining thing like heart, lung, bowel means small bowels, large bowel, everything is involuntary. But then the breathing is the only thing which is partially voluntary and partially involuntary. So a long time back, yogic teachers and philosophers were trying to control through breathing, because breathing is something which connects your internal mind. And then through that, we can control. And that's why all that yoga we have is through breathing. For example, if you do abdominal breathing, your stress goes away. And in abdomen breathing, both sympathetic and parasympathetic nervous systems are stimulated. And if you close your eye and just do abdominal breathing, it can give you relaxation. I've been a follower and disciple of Sri Sri Ravi Shankar. In fact, I had highest degree in art of living. That's called blessing course, which I did under him. And he is my teacher and he's my God. And then he says, breathe is the biggest secret that nature has put in you. It is linked to your emotions. Through breathing exercises, you can control your emotions. You must do a little bit of breathing exercise regularly, then you will have more say on your mind. And then I'm talking about abdomen breathing benefits. Now, these things, it's a simple thing like an abdominal breathing, has not been maximally used by us. Now, I'll show you an equipment called a Respirate. Now, this is available on Amazon. So what it does is there's a belt which has to be put on abdomen, and then there is a headphone. And the system says breathe in and breathe out. And it tries to control your breathing. And then it trains you to breathe slower and slower. So in fact, it's nothing but a mudra pranayama. Now, this equipment is FDA-sponsored equipment, what's called non-therapy for treatment of hypertension. And obviously, it is digital. So at the end, it will give you a chart, how many times you breathe and whatnot and everything. And this is nothing but a mudra pranayama. So I'm telling you this because we need to find out how we can make all our, say, abdomen breathing and all our gadgets powerful. So other thing which I want to do, because some day of might be engineering, is to have how to train people for yoga. And I have an Xbox 360, which has a software called Your Shape, Fitness Involved. And this whole thing teaches you, or it's about gesture-based technology. So I just want all of you to consider to teach on gesture-based technology. And now if you see in this Your Shape Fitness Evolved, there are only around 20 asanas. But then it is such that it trains you to find out how to do that asana, and then the position to be attended. The moment you attend the required position, it gives you, say, red signal, and then it teaches you. So I want all of you to think in that direction, that we need to find out how we can do, say, yogic training, or say asana training by gesture-based. So today's topic is about cultivating research in yoga, because research has increasingly been indicator of excellence of any university and country. And because you're all students of MSc, and you need to open this whole window of research. So what is research? Research requires a continuous intellectual engagement. I think it's very more important. Continuous intellectual engagement. So suppose you have any topic, you need to think all the time and analyze intellectually. So that's the process. And you can't do that unless you have passion. So second important thing for research is passion. And obviously, once you do that, you go into a creative thinking. So I'm just giving you brief about what is research. It answers scientific questions, solves problems, and at the end, you make something new that didn't exist. Or what is important in health research, where the yoga is part of it, is to improve the quality of life of a common man. That is most important. And research makes a difference. It investigates important questions, and then it has to be creative, innovative, imaginative, and most important, you have to think out of box. So yogic research would always be beneficial when you think out of box. It is fluid, flexible, and research is a creative process. There must be recognition that there is no best type of research. There are only good questions matched with appropriate procedures of inquiry. Is always driven by researcher. So what is the process? So research process involves initiation to fix topics or problems. Stage 1, we survey, define the problem, make the research plan. Stage 2, problem solving stage, oral presentation. Stage 3, writing report, data arrangement. And stage 4 is publication. So this all thing has to go, and I think you have to follow this. So research, it starts from a problem, formulation, initiation, and then you go into solving problems and making outcome, and you have to either publish, patent, or market. At the end, it has to be what is called as a socially useful innovation. So far, are there any questions?
No.
No, sir.
Because I'm talking with a non-medical audience, so I thought let us find out whether it's okay. Go ahead. Shall I go ahead?
Can I see first slide, sir?
Which one?
First slide. Yes. No. First slide of research methodology. No, it's much before. It's not like this. When you were showing this present slide, no?
Acha, just before that.
Yes, before this. Yes, this one.
Now I'm going to share all these slides with you.
Okay, thank you very much.
And in addition, Mr. Niranjan has promised to record, and we'll share
Okay.
the recording.
Okay,
Sir, recording
thank
is
you.
on, sir. Recording is on, sir.
Oh, yeah. Okay?
Yes, sir. Yes.
Yes, sir. Thank you very much.
Yeah. So every research starts from a question. Now, this is a research process. And that question, then you want to find out whether there is an answer available already. That is called literature review. The problem with yogic research is there may not be very high literature available. That's why you have to go. And today's my aim is to sensitize you that there are several papers available, and yogic research is done everywhere in world. Then you refine the question, then operationalize, then you need to design study. And in that design study, I'll briefly show you about what are the various research parameters. And you want to, once then yogic research also requires ethical committee approval. And then you do research, collect data, and write. So it starts from what is called as defining a research question. So research question starts from something you observe, you encounter, and you ask a question called why? Why this? And that's why once you are open, why this gives you the beginning of research. Now, why it is objective of doing study, why, and certainly about the health issue that researcher wishes to find out. So what are the research examples? Well-crafted research guide, systematic planning of research, formulating your questions precisely enable to you to design a study and good chance of answering a question. Now, it's a question for you. You are seeing one aeroplane, and that is a Dornier aeroplane, and down you are seeing what is called as ESWL, extracorporeal shockwave lithotripsy. So this is a non-invasive way of crushing stones. So can anybody tell me what is the relationship between a Dornier and ESW? Question to you. Hello?
could you repeat the question, please? Sir?
You can answer the question. Just unmute yourself and answer.
The student asked you to repeat the question.
Yeah. This will be a little more interactive so that people are interested. Anybody knows this, or I will answer?
Sir, could you please repeat the question?
The question is, what is the relation between Dornier aircraft and extracorporeal shockwave lithotripsy, that is non-invasive way of crushing stones?
No, sir, please explain.
Please loudly.
No, sir, please explain, sir.
Okay. Now, Dornier came in what is called as the supersonic jets. And when the supersonic jet was taking takeoff, a ground engineer observed that the metallic debris on the airport was getting fractured. So, two findings: takeoff of a Dornier and say fracture of metallic debris. So he thought that this is because of that Dornier's takeoff. So this was an observation. And then he suggested, and he went to his boss and put his finding. Sir, what is the relationship between these of two? Apparently there was no relationship at all. But then Dornier put the mind into it, and then they're finding out that when the Dornier takes off, there are waves created. And then these waves, they developed, do a research, and through that, the birth of this extracorporeal shockwave lithotripsy came, where it is one of the best thing to happen to humankind, where the stones inside kidney, pancreas can be crushed from outside without taking any incision. And from a simple observation of that ground engineer, Dornier investigated, and then they did a series of product developments, and then they came of this. And believe me, Dornier made 10 times more money in ESWL than the aircraft. So this is what is called as observation and cause and effect relationship. Other thing, cisplatin. Now the scientists were studying what happens to cells or migration of cells when they are exposed to microcurrent. So all these cells were in a cell culture media, and they were putting platinum electrode, and then they were studying with various degree of voltage what happens to the cell movement. Somebody thought while doing this that the cells are not growing around electrode. Observation that cells are not growing around electrode. And then they just took that fluid outside, which was getting around that electrode, and then they processed and then found out that the platinum under the micro electrode exposure creates a compound called a cisplatin. And through simple observation, they were able to identify this drug, which is extremely good in what is called as squamous cell carcinoma. See, I hope everybody knows about penicillin, that the penicillin, how the mold of Penicillium notatum, which showing that the bacteria do not go round the mold, and then through that the penicillin was discovered. So this is about observation, asking a question, why, and development of products. So now I want a question from you. Can you have a research question in yoga which can go into research? Okay, it's open. You can put in the chat box if you want. Niranjan,
Yes, sir.
let them put some research question of their choice in chat box.
Yes, sir. Yes, sir. Dear students, please put your questions, whatever comes to your mind.
Simple thing, which asanas will be useful in some disease or something, their observation.
Sir, I'll ask one question. Yesterday only we met Swami Ramdevji, and at Pune only we were there to invite him for our NLC program.
Yeah.
And before that he had a long session, around 2 hours yoga session at Sadhu Bhaushindi Stadium, Pune. So in his session he spoke about how yoga is beneficial for various of physical elements. So I wanted to ask one particular question. It is said ki yoga is also curing cancer cells.
Yeah.
As you are oncologist, I just saw in your profile. So what are the asanas or pranayama practices that can help to get rid of cancer?
Yes. So this is a good question. So the research question is, will asanas or pranayam can reduce the growth of cancer cells? I think this could be a question. Now, for the students, everything inside your body grows. Nails grow, hair grow. But then all this growth is limited. It is what is called disciplined and happens with an aim. Let us say a surgeon has taken incision. The moment you cut the skin, the edge of the skin starts growing. But how long? As long as it meets the edge of other side. The moment it meets, it stops. So this is normal growth. And suppose this becomes too involuntary, incoordinated, and excessive, that is cancer. So cancer is inadvertent, inordinary, and excessive growth. So how this happen has to be found out. So it's a good question. I'll go into down normally. So can yoga give, the question was, what is the evidence that yoga meditation have health benefits? And then these are the exercises, stretching for flexibility, it improved strength, improved balance. So all these parameters can be measured. So you can measure flexibility before yoga and after yoga. You can measure the strength, you can measure the balance, and then you have a what you call as control of people before and after, and then you compare with statistics whether it is effective. That is how we can do research. So there is a good scientific evidence that increases muscle and bone strength. It increases lean muscle and decreases body fat. It helps control weight, enhances your psychological well-being, reduces depression. So these are all several papers available which suggest. Then health benefits of yoga. So the achievements are admirable. So reasoning and passive observation were the main techniques of scientific research. And to achieve this, you require scientific approach. For this, you require research attitude and aptitude. So my aim today to develop this scientific inquiry and research attitude. So once you do that, we'll go into remaining thing are conducting research review, refining question. So we'll go into design study, because that's how we are doing. The research, you can have observational study, or experimental study. And then we have descriptive, analytical, and then experimental, we have what is called as randomized control trial and non-randomized control trial. And in case control and cohort. So I'm going to give a little more information. So analytical cause-effect relationship, analytical studies, prospective, and retrospective. And you can have combined. So in a prospective study, you are studying something from today to future. Whereas retrospective, you are studying from before. So backward tracing is retrospective, forward tracing is prospective. So other studies, we have case reports. Now, I just want all yogic research to be done by publishing a case report. Now, MIT School of Yoga can have maybe folders on their website where all yogic students can upload their case reports. They have tried these asanas in backache, these asanas in ankylosing spondylitis, and what happened. And then it should be available to access to everybody. So once you have a case report, then somebody else can go through that and then try to find out whether they can repeat. And then subsequently you have maybe 10, 15 cases available, then you can do further study. So then we can do what's called the case control study. So example is efficacy of BCG vaccine in the prevention of clinical leprosy, a case control. And then we have cases, we have control, and immunize, unimmunize, and depends on the odds ratio you're able to find out. It's called case control study. Then we have what's called the cohort study. In cohort study, effect of fetus and exposure of 10 rem of radiation during first trimester of pregnancy. And then we get cohort and cohort control. Then we have disease, no disease. And then through the formulation, you can do a cohort study. Then we have qualitative study and what is called as experimental and quasi-experimental. So historically, we do for the clinical trials, and clinical trials have been long history, and formal record of clinical trialist dates back to the times of trialist. And then the first trial was of Paul Ehrlich of arphenamine. Alexander Fleming did the trial for penicillin. Then Gerhard Domack did for sulfonamide. And then Waxman did for streptomycin. So these are the history of clinical trials. So it requires involving human subjects like yogic research, moved forward to a time, and you have to compare with the control group and must have methods to measure intervention. That is more important because there's something to measure and focus on unknown effect of medication and must be done before medication. So these are the core components. And then we have what is called as a randomized or blinded control trial. Then randomized double-blind control trial, non-randomized concurrent control trial, placebo trial. Then you can have what's called historical control trial, crossover trial, and withdrawal trial. There are the various types of clinical trial designs. So randomized, we just choose the patients by randomization table and then divide into the group. And when nobody knows, participant, doctor, nobody knows which group the patient belongs, it's called blinded. And then when everybody doesn't know, that's called double blind. And then we have a control that it is given placebo. So shall I go into detail or this is enough, Niranjan?
Okay, sir, it's okay.
So anywhere, all these interventions you compare with something which doesn't work, that is called placebo. And then researchers believe that placebos work by reducing tension. And then we have the study recruitments, we have to recruit. And then we go into phases of clinical trial. This usually does in drugs, where it goes into drug discovery phase, preclinical phase, clinical trial phase. And preclinical, you do pharmacodynamic, pharmacokinetic, toxicology, and assessment. And the clinical trial goes into phase 1, phase 2, phase 3, and phase 4. So in phase 1 new drugs, we go to randomized screening. We want to find out toxicity. It takes around 10 to 12 years, rational drug combination. And then we have preclinical, pharmacological study, pharmacokinetic study, and then toxicity studies, subacute toxicity studies. Actually, this whole thing doesn't happen with yoga. Okay. Then phase 2 is clinical investigation, patients with target disease, and 100 to 300 patients are either receive placebo and randomize and establish efficacy. And phase 3 is after therapeutic. So I think for us, phase 3 and all that is not possible. So we go just down. So what is called as a randomized controlled trial. So we start the study. If you have study group, control, that means they will not receive anything. And then so study group, control group. And for us, the control group will receive something otherwise, whereas study group will receive yogic intervention. So crossover, your initiation of study, end of the study, and then midway, it's crossover. So we have study group, which afterwards become control, and the control group, which after midway becomes study group. So I did several trials long time back, and I'm a neurologist, so I did a lot of several trials on male erectile dysfunction. So we were first to conduct a clinical trial on Viagra. Then we conducted a trial on tadalafil, apomorphine. And then what is required is taking an informed consent. Experiment must be good for the society. Results not obtainable by other means. Experiment should be based on prior animal studies. Obviously, this is not required for yoga. And then risk versus benefit, project subject against injury, disability, or death. Then we usually have what's called as inclusion criteria and exclusion criteria. So suppose you want to do something for the backache, so you should decide which patient you will take. Mild hypertension, latest example. These are the example of mild hypertension, age above 40, 50, patients giving consent. This becomes an inclusion criteria. Then we require a sample size, and you require a statistician, depending on target population, and it's an expert. So with this background, do you think it is possible to conduct a clinical trial, double-blind clinical control trial in yoga? What is your opinion? Answers. Can anybody answer?
Yes,
Niranjan?
sir. Yes, sir. I think so. Yes.
Let them answer this question. With this all background, can you do double-blind clinical control trial in yoga? You can do a chat GPT if you want. Okay. Now this is from ChatGPT. A double-blind control trial would involve study design where both the participant and researchers are unaware of specific treatment being administered. in this case, one group of participants would receive an yoga therapy, and another group receive a controlled treatment of placebo. However, it is important to note that implementing a double-blind design in yoga therapy trial can be challenging due to the nature of intervention. Yoga therapy involves physical postures, asanas, breathing exercises, pranayama, meditation, relaxation. These practices are typically taught by trained instructors. Yeah. Yes, madam.
Naeem, mute yourself. Okay, sir. Someone has unmuted.
Yeah. Really, go ahead. Okay.
Yes, sir.
Yoga
Yes,
therapy
sir.
involves.
Pardon, sir?
I want them to be involved so that interactive becomes little interesting.
Yes.
So yoga therapy involves physical postures. So hands-on intervention requires active participation. So in some cases, researchers may implement a sham or placebo intervention as a control. For example, the control group could engage in stretching exercises or receive educational session about general health, while the experimental group receives an actual yoga therapy. This is far more important because I am requesting everybody to do this research. Nevertheless, the researchers can still blind the outcome assessors and who measure the outcome and collect the data. So, in conclusion, conducting a double-blind controlled trial in yoga therapy requires careful consideration and adaptation of the study designs and accommodate the unique aspects. So, I just want all of you to consider doing research in yoga, naturopathy, and Ayurveda on a priority basis because these are all Indian products. It's Indian culture. It's all India. And therefore, studying them and doing research, I think it is a scientific patriotism. So I want all of you to join this flow of scientific patriotism and see that you do research to make our culture, our civilization, our products proud. So we need to find out how we can do what is called as ancient wisdom with modern knowledge. So what I did now is, Niranjan sir. Hello.
Yes, sir.
This is my paper on yoga.
Okay. Nasal cycle.
Now everybody talk about nasal cycle, and we say one nostril is open and another nostril is closed. This is your yogic observation. Do you agree with me?
Yes.
Yes.
And
Yes,
then,
Yes, sir.
then everybody goes on, say, fighting with you. How it is possible? We have two nostrils, both are open. And how can the air go through only one nose, rather nostril? Other nostril is, even though it is open, how the air will not go? Isn't it?
It does, but then one of the nostril is predominant and the
Dominant.
other one is not dominant.
Yes. And this I answered and I published. So what we did, we had a paper about MRI changes in nose by a German rhinologist, and he developed a system by which he used a functional MRI, and then he was saying that one of the nostril is open and there is a nasal cycle. So this paper came, which was it had nothing to do with yoga. It just came about a nasal cycle. And I thought this has to be correlated. So I wrote the first paper on yoga that nasal cycle is there and it has been proved by modern technology. So that's why I want to call it ancient wisdom with modern knowledge. Okay? So this is about observation, that whether there is nasal cycle at all. And then this is the answer. Now, everybody concerned about who funds. There are the various sites gives you funding. Department of Ayush gives a lot of funding. Then Central Council of Homeopathy. Then Central Council of CCIM. Central Council of Research in Ayurveda. And then there's called American system called National Institute of Complementary and Alternative Medicine. They give funding. Then TIFR gives funding. So these are the various sites which gives funding. So for yoga research, the funding is no problem. Now let us go ahead and find out what are the levels of international research being done in yoga. So international research, if you go, clinical trials of yoga therapy have been conducted to evaluate its effectiveness in various health conditions. While I don't have access to the most recent studies conducted in my knowledge, I can provide information on some notable clinical trials of yoga therapy. Now, this is ChatGPT. So, chronic pain management, anxiety, depression. So, chronic pain management study published in internal medicine, and then anxiety and depression. Then cardiovascular health. So I thought I just want to refer you to this very famous paper. The cancer related, because several clinical trials have explored effectively yoga therapy of cancer related symptoms such as fatigue, sleep disturbance, quality of life. So while results have been mixed, some studies have been showing promising outcome. For example, a study published in Journal of Clinical Oncology in 2017 demonstrated that yoga improved sleep quality and reduced fatigue in cancer survivors. Niranjan sir, this is your answer.
Yes, sir. I'm reading it. Yes.
And I suppose we'll give a PDF to everybody. Then it is
Sure.
important to note that results of these trials may vary. So
Yes.
I just want to start my sensitization with this famous article, which is what is called as a bibliometric analysis. So what they did, they were evaluating all randomized controlled trials of yoga. And then published between 1975 to 2014, total 366 papers were included, reporting 312 RCTs from 23 different countries, involving 22 odd participants. The median study sample was 59. So this gives you detail that a growing number of controlled trials. What happens? All these trials were taken from PubMed, Scopus, Cochrane, IndMed, everywhere. And then 2488 records were seen, and then 1530 records were found duplicates. So 1041 record excluded, and 4 written and full text articles available, 123 full text excluded. So we had 366 full text article on 312 randomized controlled trial on yoga. And this is international. So I think this is the biggest thing to happen. And I think we should clap ourselves that we are generating so much of interest across the globe. So 366 papers, sample size 59. And then this is the distribution. 136 were from India, but then you can see all the countries involved. And these were the diseases where it was tried: healthy, breast cancer, asthma, depression, type 2 diabetes, chronic low backache, hypertension, pregnancy, schizophrenia, menopause, multiple sclerosis, metabolic syndrome, stress, CAD, COPD. So I think this is so long a list. And I want all of you to go and pick up one, do a review of literature, and find out how it can be done. So I'm not going to go in detail. These are trials. And then these were interventions. 35 were Hatha Yoga, 31 Iyengar Yoga, 30 Pranayama. So I think this is a give list of the yogic intervention. And then exercise, yoga, physiotherapy, Ayurveda, Reiki. And then breast cancer, 17 RCT, depression, 14 RCTs, asthma, another 14, type 2 diabetes, 13, 119 did not define the style of yoga used. So I think students, have you gone through the Google folder which I sent? निरंजन सर कोणी ऍक्सेस केलं का?
नाही केलंय.
तर त्यांना सगळ्यांना सांगा हे सगळे पेपर्स आहेत
हा.
ते मी त्याच्यात टाकलेत.
ओके हे परत
हा खूप पेपर टाकलेत, एक
Yes.
25-30 आहेत.
येस.
तर बेसिकली ते त्यातूनच आपल्याला हे करता येईल. So in conclusion, bibliometric analysis presents the most complete up-to-date review of randomized controlled trial and can serve to inform patients, therapists, and researchers on the available yoga research evidence. The result shows marked rise in number of such trials in recent years based on research increasingly conducted outside India. For almost 4 decades, researchers have compared the range of diverse yoga intervention control conditions in varied participant samples. This research has had its limitation, with most trials being relatively small in size and failing to explore even common medical condition. So I want all of you to do a future research for yoga's efficacy, doing multiple RCTs, and I think further ICTs need to be done. So where? Now, these are the examples of all articles, and you can see all these articles are published in famous medical journal. So yoga for chronic low backache and internal medicine annals, then stretching self-care book in archives of internal medicine, then effect of short-term intensive yoga program on pain, functional disability and spinal flexibility in chronic backache. So these are all papers on chronic backache, and which were all published in big famous journals having a lot of importance. Then this is about depression, interventions in pain and associated condition with another list. And this is a third list, Iyengar Yoga, and you can see they're all famous journals. So we'll do one by one. Some of them things are available. So efficacy of Ayurveda and yoga intervention in healthcare workers in tertiary care hospital during say COVID-19. It was a randomized controlled trial. So now this is the same paper which I talk about yoga for chronic backache, and it's a nicely designed paper. 313 patients, yoga with 156, usual care 157, and conclusion, offering a 12-week yoga program to adults with chronic recurrent backache led to greater improvements in the back function and dental care. Now, all these papers, you can see that there is something has to be measured. Now, here the scores of Roland Morris disability questionnaire, and this is the one which gives you clue. Then there are some ready-made protocols available, and even the protocols are published. So this is a randomized controlled trial of yoga for strengthening exercises of knee osteoarthritis. So osteoarthritis is a disease of knee which is very common, and this is the knee joint. You can see this is a cartilage, this is a femur, this is a tibia, and this moves here. And in osteoarthritis, this cartilage is lost, and then they have pain. And these are the yoga poses for arthritis. And then this is a trial where everything, if you go to this paper, which I gave into Google Drive, everything is given and you need to just copy and find out how we can replicate. Then study protocol for efficacy of yoga in ankylosing spondylitis. In ankylosing spondylitis, what happens is the spine becomes what you call as it becomes stiff, and then there is a calcification of joint, say ligaments between the spine. And these are the exercises. And this is another protocol available where you have to go and down, and you can replicate. Another RCT for menopausal quality of life. And I think this is another study design where now this is the one where the results are there. And conclusion, all women were menopausal and many of them seek medical advice to improve the quality of life. And little evidence, yoga appears to improve the menopausal quality of the life. Then everybody talking about aging. And then this is a very nice paper which suggests effect of regular yogic training in growth hormone and dehydroepiandrosterone sulfate as an endocrine marker. So this is one which shows that yogic exercises can sustain and stop aging. So yoga can prevent seizure. There are several papers available, and you can do some more. Then yoga, and then post-stroke rehabilitation. Then yoga to improve the quality of life in patient of life, say cancer, which we discussed. Then pain in hand, because nowadays everybody in the IT develops some pain. This is called a carpal tunnel syndrome. And there are several papers available where yoga can give you short-term relief rather than giving steroids. So the health conditions in which yoga can treat is arthritis, allergies, asthma, hypertension, coronary artery disease, irritable bowel syndrome, heartburn, constipation, tension headache, then menstrual discomfort, menopause, pain in back, hip and knee joint, depression, anxiety, substance abuse, skin disorder. So this is a list where all of you can go and do some research. Now, in MIMR Medical College, they are studying the effect of yoga on endocrine parameters in adolescent, what is called as POCD, polycystic disease, where these are the symptoms and they become hair loss, then hirsutism, and then they study the effect of yoga and asanas on endocrine. So this was the project which was done, started with MIMR and Kaivalya and so these were the study subjects. And this is about how the ovary looks. Can people know what is ovary and all that?
Yes.
Yes, sir.
Yes, okay. So this is about the androgen levels going up, then adipose tissue, insulin resistance. So you have to measure AMH, FSH, LH, prolactin. And this project was started with Kaivalya, and there were yoga poses given. So, and in addition, they decided to do a Nadi Shodhan pranayam, Brahmari pranayam, then Bhadrasan, Surya Namaskar, Bhujangasan, Naukasan, Dhanurasan, warrior pose, and then these were outcomes. Niranjan sir, this project
Yes,
was
sir.
rather it didn't continue, but just I talked with Dr. Korde madam. She will be too happy to collaborate with you and with your students so that they could go and participate actively.
Yes, sir. After their exam, we have planned certain visits. We'll definitely include Myanmar visit in that. Sir.
And then this project is already ready. She has recruited patients, and maybe even if on 2 or 3 days in a week, even if one of your MSc training goes, and then they can have OPD and demonstrate and do it. I think that will be very fruitful collaboration. Or other thing is you can go to our hospital in Loni.
Yes,
and
Vishwaraj.
Vishwaraj, and you could have some OPD with them for yoga,
Yes,
and
yes,
all these projects you can continue there.
yes, sir.
I just want to end with something called chakras. I hope everybody knows about chakra. But then these are the anatomical sites of Muladhara, Swadhisthha, Manipur, Anat, and Vishuddha and chakras. And then each chakra is related, and its metaphysical counterpart is endocrine glands. And these are the endocrine glands which are correlated with these chakras. And I just wanted to have a study that all these chakras are related to both endocrine gland as well as plexuses. So these are the plexuses. E is plexus, sacral plexus, hypogastric plexus, iliac plexus, cardiac plexus. So my suggestion is you could do some research to find out whether there are endocrine receptors on nerve plexus, so that both are being controlled. This could be one of the research question, is whether endocrine receptors are available on these plexuses which are correlated to chakras. So with this I end. Asatoma Sadgamaya, Tamasoma Jyotirgamaya, Mritoma Amritgamaya. And thank you for inviting me, Niranjan sir, for sensitizing your MSc students for doing research in yoga. So I'm open for questions.
Dear students, please feel free to share your questions, share your views.
Let them unmute. I will stop sharing.
Yes, sir.
Was it useful or it was too difficult to understand?
It was
Not
useful, sir, of course.
It was easy.
Because this was given for
nice, sir. It was useful.
and you can always email me. So first thing is you access your Google folder, Google Drive folder, where I'm going to put this presentation as well. And you are free to utilize this presentation for development of yogic research. And all that knowledge, all the papers and several more papers, because after some time people don't just listen if it goes beyond. So I wanted to and conclude by 45 to 50 minutes. So did I encourage you and sensitize you for research?
Yes, sir, of course.
Yes, of course, sir.
The certain medical terminologies which were quite difficult to understand, but then
No,
the
but
entire
I can answer now because we have a little more time.
yes, sir. So this term that you were talking about, RCT. So could you please elaborate on that?
RCT is randomized clinical control trial. Okay. Suppose you have new drug. It goes into various phases. And what you do is all that trials are done. It is called control trials. So we divide the people of some disease into two groups. One group will take drug, that is called study group. The other group doesn't have drug, but they get something which is comparable to drug, that is called placebo. So let us say we want to study some new drug. So the capsules are created in such a way that capsule A will contain drug, whereas capsule B will not contain drug. Okay, so this is design. Now you can't just give all drugs to the patient as they come. So we do what is called randomization. So randomization means before you start study, you go into a statistical method called digital randomization. You can Google it. It gives you randomization table. In the table, it gives you first patient to group 1, third patient to group 2, something like that. And you have to follow that randomization table. That means you are not just classifying first patient to A and second patient to E. So this is randomization. And now, no, both patient and the surgeon or doctor doesn't know which group is getting drug and which group is getting placebo. So that becomes a double blind. So blind, if sometimes what happens, you can't have, suppose you are comparing some operation. So surgeon sometimes knows, it's called then single blind. Double blind means both do not know. And now third thing that is coming is called triple blind. Because at the end, that everything goes to for a database analysis and computer scientist, and then he knows. So he also doesn't know. So this is called triple blind. So at the end, when the study is finished, all parameters are measured, their follow-up is done, its outcome done, and then all tables are made of outcome. And at the end, they open that group 1 was placebo and group 2 was drug. This is what is called a randomization. Now we have to do same thing in yoga. So suppose say you are doing for backache. So one group will receive the exercises and other group will receive something similar, but not yogic exercise. But then it becomes a little difficult because people know. But then they do not know because the group A and group B, they won't talk with each other. Okay? Nice question. So anything, I'm there to explain. Now, I have
Dear
developed.
students, you can even type your questions in the chat box.
Yeah.
If anyone wants to type the question, he can or she can. Please ask your questions. Though you feel questions are very of simple nature, still feel free to ask.
And let me appreciate efforts of Professor Niranjan Khaire to organize such lecture, because at the end, we want to have more research in yoga. And now yoga is a priority of India, the world. Everywhere people are doing yogic research. And if you go outside, yoga is so popular. And then there's something called as hot yoga, where yogic exercises are done in a room where the temperature is set up to 42 or 40 degrees. All combinations and modifications. And yogic magazines, Khaire sir, the advertisement in yogic magazine is costliest in America.
Oh,
And I think it is so popular in US that everybody is concerned and everybody does some yoga. Now, then I didn't go into much detail about transcendental medicine and all that. There's a lot many things happening. So I just wanted to restrict to 50 minutes. तुमचे टीचर आहेत का याच्यात नाही?
आहेत एक आहेत प्रोफेसर मृण्मयी गोडबोले आहेत म्हणून आहे.
गोडबोले मॅडम त्यातलं काहीतरी करता येईल का बघा तुम्हाला.
Sure, sir.
Yes, sir, sure.
आणि बेसिकली कसं आहे माहितीये का, आम्ही सगळे डॉक्टर लोक फार इगोइस्टिक असतो. आम्हाला फार इगो असतो, त्यामुळे तुम्हालाच जावं लागतं.
नाही सर, आता तर वाटलं नाही आपल्या बोलण्यावरून.
नाही नाही, आमचं जाऊ द्या हो. पण आता समजा तुम्हाला ऑस्टिओआर्थरायटिस आहे.
हो.
आता ऑस्टिओआर्थरायटिस इतकं कॉमन आहे, इतकं कॉमन आहे, आणि मी तुम्हाला सांगतो ऑस्टिओआर्थरायटिस इज कंट्रोल्ड बाय एक्सरसाइजेस अँड आसनास. तर तुम्हाला त्याचा रिव्ह्यू करून तुमचं जे काही ज्ञान आहे ते शोधून काढावं लागतं की कुठले आसनं पाहिजेत, काय पाहिजे, त्याचं स्टेप अप कसं करायचं, काय नाही.
Sir,
Hmm.
sir,
हा, बोला.
येस येस.
can mudras also helpful for therapy?
येस ऑफकोर्स.
Okay.
आता मी तुम्हाला सांगितलं ना, मुद्रा प्राणायाम तो रेस्पिरेट करून टाकले त्याने. आता तुम्हाला माहित आहे, तो माझा ऍपल वॉच आहे, तर त्याच्यामध्ये माइंडफुल मेडिटेशन असतं. आणि ते काय करतं, तुम्ही ते वॉच सुरू केलं की जस्ट टीचेस यू टू ब्रीथ इन अँड ब्रीथ आउट. दॅट्स इट. आणि ब्रीथिंग एक्सरसाइजेस आर फिनॉमिनली युज्ड एव्हरीवेअर इन. आता तो मला डॉक्टर शारंग पाणीचं नाव माहित असेल. ही इज
राजीव शारंगपाणी.
Yes, sir.
खरे सर, तुम्हाला काही हो,
हा.
ही ट्रायज टू फाइंड आउट सोल्युशन थ्रू एक्सरसाइज.
येस येस.
तुम्हाला ऍसिडिटी जरी असली तर तो म्हणतो ॲब्डॉमिनल ब्रीदिंग करा, थोरॅसिक ब्रीदिंग सोडून द्या, आणि काय म्हणतात कॉन्शियसली ॲब्डॉमिनल ब्रीदिंग करा, तुमची ऍसिडिटी निघून जाईल. आणि आता हे ऑस्टिओआर्थरायटिस वगैरे सगळं जे काही आहे, ऍक्च्युली ऑस्टिओआर्थरायटिस इज नॉट अ डिसीज ॲट ऑल. आपल्याला दोन प्रकारचे मसल्स आहेत नी जॉईंटच्या आजूबाजूला. समोरचे देस कॉल्ड क्वाड्रिसेप्स अँड ऑल दॅट, अँड मागे असतात ते कॉल्ड हॅमस्ट्रिंग्स. तर आपण वापरताना नेहमी क्वाड्रिसेप्स वापरतो आणि हॅमस्ट्रिंग वापरतो, त्यामुळे हॅमस्ट्रिंग वीक होतो. and this disequilibrium between hamstring and quadriceps creates the motion in the knee joint and then reduces the space. त्यामुळे what is required is to strengthen hamstring. तर तुम्ही hamstring strengthening आसनं कुठले आहेत?
Yes. So which asanas will be helpful for to strengthen the
हा,
hamstring muscles? Yes.
हे घेतले आणि त्याचा तुम्ही जर ऑस्टिओआर्थरायटिस वापरलं, शेवटी काय असतं, तुम्ही नी जॉईंट रिप्लेस केलं. रिप्लेसमेंट इज नॉट सोल्युशन. शेवटी ते हॅमस्ट्रिंग जर वीक असेल तर ते नवीन जॉईंट पण खराब. सो व्हॉट इज सोल्युशन इज टू स्ट्रेंथन हॅमस्ट्रिंग.
Actually, sir, basically we are lacking in some clinical setups. Main thing is that regarding
तुम्ही MIT मध्ये योगाचा ओपीडी सुरू करा ना.
because there are few
आपल्याकडे
areas,
इतके विद्यार्थी आहेत.
especially for the neuroscience.
Ah.
So we require.
नाही, तुम्ही आपली करा, ते सायन्स पेन सोडून द्या. तुमच्याकडे पेशंट आला, बॅक आला, म्हणजे मी सांगितल्याप्रमाणे 5-25 डिसिजेस वर तुम्ही जस्ट ओपीडी जरी काढली MIT कॅम्पस मध्ये, आणि बाकी हेल्थी लोकांना तुम्ही असं शिकवा. आता आम्ही सगळे असं शिकायला जातोच.
येस.
आता मी आठवड्याला एकदा ते मेडिटेशन करतो. नंतर माझी मिसेस जामकर तर रोज जाऊन सगळे आसनं करतेच. सो तुम्ही यू डोंट टार्गेट डिसीज पीपल, यू टार्गेट हेल्दी पीपल.
येस.
आणि संध्याकाळी ठेवायचं, सगळे हॉल रिकामेच असतात. लोक आनंदात येतात, कारण बाहेरच आजकाल योगिक टीचरला मिनिमम 5,000 रुपये महिना द्यावा लागतो पर हेड. तर तुम्ही जर द्यायला सुरू केलं तर तुम्ही येतीलच.
Yes, sir. We are in the plan of that to start free sessions for.
आणि हे सगळं अण्णाभाऊंना खूप आवडतं योगा.
हा. येस येस. सिनियर कराड सर लाईन. बरोबर.
आणि आता काही लोकांना तुम्ही विश्वराजला पाठवू शकता.
हो.
तिथं एक योगिक ओपीडी, योगिक थेरपी हे सुरू करायची. आणि मग काय होतं सर, ते तुमची सगळी मुलं आहेत ना, ते प्रॅक्टिकल ट्रेनिंग घेऊ शकतो.
Practical training is more important, na, sir, in this research.
हो.
Any more questions from students?
सर माझा ईमेल आयडी dr.jamkar123@gmail.com फॉर रिसर्च पर्पज.
टाइप करतोय सर मी dr.jamkar123@gmail.com.
बस.
चॅट बॉक्स मध्ये आहे, चेक करायचं
बस,
सांगा बरं.
बस. कारण तो जामकर जीमेल आहे ना, तो इतका ओव्हरफ्लो होतो.
हो हो केलाय मी टाइप.
So let us call it the day.
Thank you, sir, for
Sure, sir.
accepting our invitation on short notice and
And
delivering
then
a wonderful
please
lecture.
convey my regards to Dr. Milind Pandey.
Yes, sir. Yes.
On his suggestion only, we were connected.
Yes. Just before the session, we had a talk, and I conveyed him that.
And then send me the recording of this session.
Sure, sir. I'll share through the
And
drive.
then I will put it on my YouTube channel.
Yes, sir. Yes. Surely, sir.
Thank you, sir.
Thank you, sir. Thanks. sir.
Thank you.
Thank you so much, sir.
Thank you, sir.
Thank you, sir.
Yes, sir.
हे असं करा, सगळे
हा.
व्हिडिओ करा आणि
व्हिडिओ ऑन करा, तेच म्हणतोय मी. आय रिक्वेस्ट ऑल ऑफ यू विथ ड्यू रिस्पेक्ट टू युअर प्रायव्हसी, सगळ्यांनी एकदा ऑन करा. आपण एकदा ज्यांना शक्य आहे त्यांनी व्हिडिओ ऑन करा. आपण एक छान फोटो काढू.
आपण एक हे करू.
हो. 1 second. Okay, one more time.
तुमचे 2 ठिकाणी आहेत का?
हो, मी बॅकअप म्हणून करून ठेवलं सर. टेक्निकल प्रॉब्लेम होता. येस, थँक यू. स्क्रीनशॉट्स टेकन. थँक यू सर.
थँक यू.
रेकॉर्डिंग पाठवतो.
हो, पाठव.
बोलतो आपल्याशी.
ओके सर, थँक यू.
ओके. With your permission, shall I close the session?
And then just contact Dr. Korde madam.
Yes, yes.
कारण तुम्हाला दाखवण्यापूर्वी मी त्यांची परमिशन घेतली.
Yes, sir. Yes.
की बाबा मी तुमच्या स्लाइड दाखवत आहे.
हो हो.
आणि मी म्हणलं पुढे काय झालं, कारण ते आय वॉज विथ कैवल्य धाम अँड ते मी कोरिलेट करत होतो. पण ते काय ते कुठलं तरी इन्स्टिट्यूशनल कोलॅबोरेशन वगैरे म्हणलं ना, ते त्याला इतकं काय म्हणतात गो स्लो असतं. ते शेवटी सुरू झालं, तर सुरू झाल्यानंतर ते कोविड झालं. त्यामुळे ते म्हणाले की मी म्हणलं आपलं MIT ला जा, निरंजन सर येतील. शी विल बी जस्ट कॉन्टॅक्ट हर.
मी बोलतो सर त्यांच्याशी. आणि मेनली पुढच्या वर्षीचे जे मुलांचे डिझर्टेशन साठी आपण थोडं आपण
माझं म्हणणं आता मी तुम्हाला एवढे टॉपिक दिले.
येस सर, ऑफकोर्स.
प्रत्येकाला एक त्याचा टॉपिक द्या.
हो हो, शुअर.
आणि लेट हिम एक्सप्लोर, लेट हिम गो टू द स्पेशालिस्ट. शिवराज मधला किंवा MIMR मधला कुठला जर तुम्ही गेला तर ते काम करा.
येस सर.
आणि त्यांना को गाईड म्हणून घ्यायचं. चल, थँक्यू.
थँक्यू. थँक्यू. Yes. Thank you, students, for joining. I am closing the session. Thank you.